friends. Great to be here today. I'm really excited to introduce you to IFA Director Tu-Anh Hoang. She is the founder and director of the Center for Creative Initiatives in Health and Population, a leading organization in promoting gender equality, sexual and reproductive rights, and health justice in Vietnam. She is the chairwoman of the Vietnam Gender-Based Violence Prevention and Response Network. And she initiated the free online counseling program for young people on sexual and reproductive health and rights in 2003, the first online counseling program in Vietnam. Tu-Anh has worked extensively with marginalized and vulnerable communities in promoting leadership, engaging on policy, advocacy, and empowering them in tackling inequality and injustice using intersectionality frameworks and an affirming approach. Welcome, Tu-Anh, to the Global Cafe.
Hi. Good morning, good evening. Yeah.
Great to have you with us. You know, you have had such an interesting career, and I just wonder if you might just tell us a little bit about yourself, your story, and how did you come to develop your focus or interest on aging?
Yeah, so I study medicine and when you just read my bio, right? So I'm my interest is on sexual and reproductive rights and health. And that's because I that felt like this is something very neglected and very much like a taboo in the country that I live, that is from Vietnam. And I think that also maybe the norms in many of the country in the regions. So and I through my work, I study medicine, but then I met so like many young people that have like a unwanted pregnancy. And Vietnam is among the countries very high rate of abortion. So then I just wonder like why. So that is like my first interest in the issue, and then like lead me to work with like a different group. So I more start with like you see young people and with this group, but then like through my work, let's see how like you ask how I get into like older people. That's I remember like one day after I have a talk with a group of mother and teenager, and then there's one like not very old, like a 60 something. She's just waiting outside the room for me until the very end, and she's very shy. And she comes and then she just asks me advice about how she can respond to the sexual demand of her husband because she's so scared. Like at her age, she seemed like she not really enjoy and found it's very painful, and I'm very surprised. Like I see why it's something that should be enjoyable or pleasurable become like a scare of a woman, and that led me to the interest of like working more on this issue of older people. And once I start working on this and I see more issue like violence, like loneliness and things like that. Yes, and then also like and I taking care of my parents when they get older, and then when I took them out for travel, then I really found like how difficult it is when you want to bring like older parent travel in country like Vietnam. So I really see more of my not only for like this interest in this work, not only as a kind of like a researcher or activist, like a professional, but also as like a child that I should do something for my parents.
Uh-huh. Interesting.
Yeah.
It's always these encounters and relationships that draw us in, led by the heart. Yeah. Well, the theme of our conversation this morning is challenges and hope in Southeast Asia. Um, uh, let's start maybe talking a little bit, painting a picture, a little bit of aging in South Africa, and maybe start with some of these challenges. We know that it's one of the fastest growing demographic transitions. The population aged over 60 in Southeast Asian countries will double well, from 77 million in 2020 up to 173 million by 2050. And,
Yeah.
just to put that in perspective, there's roughly a ratio of 11 to 1 of, 11 working age persons to every old non-working older person. And by 2050, this will be about 4 working age persons per older person. So this is a huge transition in a very, very short period of time. Just even within this a generation, it will be a massive shift. So let's, talk a little bit about that. There's healthcare systems, pension, social protection, urban planning, infrastructure. Where would you like to start? Or maybe you want to color in a little bit more about what we're getting at before we address some of those. So over to you.
Yeah. So I think like I can start with like the healthcare, like because like in this region we start as like a young, continental young region. So I think the more focus of the health system is still more like with the what we call like a reproductive age. So there's a very little service, very limited service for elderly people. Geriatric doctors, there's also like not many doctors were trained, specialized on care for elderly people, and then and most of the care responsibility also like with the family. So when these populations increase, I think it's also increase a lot of burden for the system. And then when you look at like a long-term care, this the number of like a nursing house and thing for elderly people is very limited in this region. I think except for rich country like Singapore or Brunei, for most of the other countries, you can get only like a very few uh, facility that can accommodate elder
Long-term care.
people. Yeah, yeah.
Care.
Like in
There isn't.
Vietnam, it's like only like a 10,000 older people, yeah, living in
Wow.
the, yeah, why we have like 16 million people.
10,000 are in
Yeah,
long-term care
only.
of 60 million. Wow.
Yeah, yeah.
That's shocking. And I suppose there wouldn't be a strong insurance, for example, long-term care insurance programs either to support.
No,
So it would all be self-funded. So it would be,
yeah.
uh-huh.
Yeah, yeah, yeah. And then also like regarding like also in terms of pension or social security, also that I think the big problems because it's like I think Vietnam, for example, have a quite, I think, a good number of people involved in the labor, especially women. But still, like but many people are just work for informal sector. Because like a country like a Vietnam, 60% of the people working in farming and things like that. So I mean, when you get old, you don't have a pension.
Mhm.
And I think except few country have a higher people get pension. Like I think in Thailand they have a special scheme that provide pension for almost like all people. Like 90% of the elderly people in Thailand get some kind of pension. This is just only see the number, right? Not see like if that amount of pension is enough for like to cover the
Right.
needs of people. That is another question, but that's talking about the coverage. Um, Vietnam have like about 40% of the people can be covered, or but in other many other countries like Laos, Cambodia, this coverage is very low. Um, it's like in country like in Vietnam, only very recently there's the government really put social insurance as compulsory for employer. But many years before, it's just up to the employer to to get the insurance for employee, except like
Mhm.
if you are a very big company or if you are like a state-owned agency. And here there's also a gender issue. I found that like a women, like older women, the have a less like less women receive pension that compared
Yeah,
to the men. Yeah, yeah. For the
yeah.
like
Mm.
in in the Philippines, for example, like a 50 something, like a 50% of men, older men receive pension, but only like a 20 something women receive that. So you also have a big gap of that, and this gap in terms of economics also may lead to the risk of women in terms of like gender-based violence in the older age.
Uh-huh.
Um, yeah, and then in terms of and you see also in this region, Southeast Asia region, also the area where the region where the out-of-pocket payment also very high. Like in Vietnam, for example, it's like a 40% of the expenditure is the out-of-pocket payment. Yeah,
For
yeah, for health
health
only.
costs and so on.
Yeah,
Okay.
yeah.
And
So that is,
how about your urban planning and infrastructure? How is
yeah.
that how is this pressure in Asia with these growing populations? How are you faring?
Yeah, so one of the things that I surprised when I travel abroad is that I saw so many older people or people with disability on the streets. Yeah, so
Mm.
even like before, and I first came abroad, I even said, okay, why there's so many people with disability on the street? It may that because those countries have more people with disability, and only later I learned that it's just because the infrastructure, the transportation is just more friendly with
Oh,
people. So
interesting.
then,
Okay,
yeah.
so it's more because in Vietnam, for example, you don't see people with disabilities because they can't be
You can't get out. You just can't get
right.
out. Yeah. So
Uh-huh.
so if you have the wheelchair, not everyone can accept like accept wheelchair, but even if you have a wheelchair, the road is not for you to get out and it's not safe and pavement is not always there,
Hmm.
so it's not friendly, and then that's like even for health care facility. So for them, only like less than 50% of the health facility in Vietnam access have like accessible, like have a ramp, have a thing like that, only 50%. And if you use wheelchairs, only 30% of the health facility have the how do you call it, the toilet is accessible. So if you go, you can go to the hospital, but sometimes you cannot use the toilet in the
Oh my
hospital.
gosh. Okay.
Yeah, yeah, because when they build that, it's not take into account this thing, and and I think law, like in Vietnam, law on like give the instruction for building that's like accessible building is only in the last 10 years. So it means like if it builds thing before that, it should not be accessible. Yeah.
Hmm.
And yeah, and in terms of like if you use bus, is the bus is also not accessible. I have a friend who uses a wheelchair, and that's the last year when we called taxi, the taxi came, and when he saw my friend in wheelchair, he already arrived, and he saw that, and he said, "No, I'm sorry, I just couldn't take you." So the taxi is not friendly, like a not, and the driver was not trained to to receive these people, and so that you can imagine that when you apply to elderly people, that be very
Hmm.
difficult. Yeah,
Interesting. I'd love to get back to what we were just touched on a minute ago. In many low and middle income countries, and especially in Asia, the care of older people is often within the family. But we know that this really means women.
yeah,
And as we look at this growth in population, with over 40% of older adults in Asia Pacific lacking any pension, and this is some great information coming from a great report by the Asia Development Bank, Aging Well in Asia. Great report. If I think Luana is going to pop it in the chat, but without any pension, and with women most affected due to their lifelong informal roles, participating in the informal economy. Among those over 65, 94% are in the informal sector with no labor protection or pension. And so, in many cases, women are often discouraged from careers to assume married life because of an assumption of these caregiving duties throughout their life and leaving them without any social protection. They live longer than men and often destitute, that face loneliness and isolation. But I understand this is changing, and women are starting to say opt for a career over marriage. Maybe you could comment on this a little bit, and what does this lack of a care system for older people mean for gender dynamics, and
Yeah.
particularly the expectations and burdens that are placed on women culturally, and how you look to navigate that in the future?
Yeah, uh, I think this is a great question, and I think this affect women with like all like extend to the old age in their life. So, for example, like and World Bank survey in Vietnam on uh, house like a time spending for on housework, it showed that like um, women often spend like four to like a four time
4 times the amount of time on
yeah
work as
than men, yeah, in housework. And so like and when you are a woman, you are like a mother, a wife, but also a woman like a daughter-in-law. And
right,
daughter
right,
daughter-in-law is under a lot of responsibility of taking care of everyone in the family, your own family, but also your like the family of your husband, including their parents. And many times you have to take care of the parent of your in-law rather than your own parent. And then when and you get older, then also you have to take care of the grandchildren. That is
hmm.
also, yeah. So you cannot like relax here. So that's also considered that's your responsibility. And now in I think in Southeast Asia they also have, I think, a new term they call the what they call the I just forget the term. It's called like what it mean like the family, but have only two generation. Like you have the grandparent and grandchildren. Because
Okay.
because the elder children, they just like migrate somewhere,
Right.
so they leave their children there for their parent to take care. And you are very right that. And so even the children stay with both the grandparent, but the main responsibility of care still with the woman. And then also uh, women live alone. The time of women live alone is more than men. So then also it means like and in many of these countries, it's really taken in the law that the care task is the family responsibility. Yeah. So it put really more work, more pressure on the women for to take care of other, but also to take care of themselves. Rather than they cannot like count on the other people. Yeah. So when it lack of this as a healthcare system or lack of the state accountable for this task, it's really put a lot of pressure on the family, but especially on the woman. I think there's change in terms of like a more women can like pursue their career, but then also like still there maybe their mother at home still assume take still take this responsibility. Yeah. So it may take many years more to change.
Uh-huh. Yes, and I would imagine that we'll get to that a little bit later, but that would seem to be a strong area, an obvious area to for us to be supporting and advocating for policy change on how we deal with the care economy, and particularly women and the informal work, and how do we address this. I think there was a comment that was in the ADB report that currently Vietnam, for example, spends 2 to 3% of its GDP on pensions. And just to even maintain the level that it has now by 2030, that needs to rise to almost 8,
Yeah,
9%. And that
9%.
hasn't even addressed this particular issue. This is just to maintain what it
Yeah.
is now. That would, evidently is not really sufficient. Um,
Yeah, and also another issue that I also want to mention is the mental health of elderly people. When we're talking about healthcare, sometimes people just did mention more about like some other non-communicable disease like hyper blood pressures and diabetes and things like that. But I think mental health is really, really something
mhm.
a
Oh,
very a big burden.
yeah.
And it's not really much report, and also the capacity of the system to respond to this needs also very low. We have a very few doctor like a psychiatrist or like a psychologist. For example, in Vietnam, we have only like a one psychiatrist per 100,000 people.
Wow.
No, one per 100,000. And psychologists, even less, like you gave less than one psychologist per 100,000 people.
Mm,
So, yeah, and then also when looking at mental health care, the women also report more suffering than men. And then the people also see like a loneliness, domestic violence, either from their like a husband, partner, or from their children. It's really like increase the rate of depression and anxiety. Um, Older people, especially older women. And then
mm,
also another issue that another group that I often also not see much in many of the statistics is the like more marginalized elderly people. So for example, like elderly people with disability or the lesbian, gay,
mm.
trans elderly people. Yeah,
Uh-huh. Uh-huh.
yeah.
Hey, Janine, Charlie pointed, I think the name you were looking for was the skipped generation. Uh,
Yeah, skip
Skipped
generation.
generation. Yeah, thank you for popping that in
Yes.
the chat,
Yeah.
Janine. Um,
Mm.
we've been talking, there are certainly, and we were just scratching the surface, aren't we, Twen? When we checked in before,
Yeah.
we were talking, well, my goodness, what are we going to talk about? There's so many enrich, so many challenges, but also opportunities and hope. So maybe we can start to move a little bit onto the hope side for a few minutes here. Um, Vietnam and several Southeast Asian countries have a strong network of older persons associations. And you were sort of sharing with me that many of these groups grew out of the mass organizations that were started by the government following the war, such as the Youth Union, Women's Union, and the Older Persons Union. Older persons associations are globally are growing and are becoming important strengths and foundations for communities, giving voice, community, addressing isolation and loneliness, and providing all kinds of opportunities for older people to engage in the decision makers on the things that affect them and so on. So maybe could you just tell us a little bit about the OPAs, or the Older Persons Associations, in Southeast Asia, what they do, how do they serve the needs of older people, and
Yeah, I think that's also like an important agency. I think that's important structures to really, I think, raise the voice of elderly people in the region. And it's really, I think one strong like advantage of this thing is that like it, like for example, like in Vietnam, this organization is recognized by the government. So they have in terms of like um, eligible, they eligible to, participate in these like a policy development and in involved in like the policy development. Um, uh, but then but then I think one thing that so I think it's really good, and so for example, like we have the law for elderly people, and that makes sure that the right of the older people there, and the responsibility of the society, of the family toward the people, and also highlight the priority of the elderly people. Um, the thing that I found is a bit limited is that so even like I think among this association, I think it's still very much like on the mainstream issue. So for example, like it issue like the for example of the older women, for example, like that's working on like older people in general, but the needs of some special group like the older woman, or the more minority group like ethnic minority people, migration, or people with disability, because you see, as you get older, you also keep all this identity, right? The LGBT
Uh-huh.
older people, it often not part of this mainstream movement of older people when it run by this association. Um, so I think that is something that is more, or the issue more like a issue like I said, like on gender-based violence or sexuality and something like that is still not recognized as the like on this main agenda of the
Right,
association. Yeah.
right, right. Okay. And is there opportunity then for some of these minority or under-resourced communities to, like, is it encouraged? Is there infrastructure? Is there opportunity for them to form their own old persons associations to address these particular issues? Or is it a little bit discouraged because it's can be outside of the mainstream?
Mm. I think it's there's I think some effort in the region, but still I think, for example, like if you look at the movement of the LGBT people, the region is still more just like young people, and so they are like also discriminated among their own community, and also like if you look at people with disability, for example, also you not really see people there.
Uh,
So I think it's also maybe because like when you get older, and then this is like the marginalized of marginalized, so it's more difficult
mm,
for people to form their own association, and also maybe in some country I think political situation is maybe also another
mm.
reason, yeah, another challenge, yeah.
Well, and I know that, and as we spoke the other day, that in Asia and Southeast Asia, there is still a deep respect and love for older people that permeates the society, and that that was something that you had shared, was something that gave you hope, and that there's um, a future for this work because it's already ingrained in the DNA of people, but that may be changing. And I wondered about intergenerational opportunity, or how if there is opportunity from an intergenerational perspective for people to engage, to participate together and support one another. I noticed that Robert Nestelar is on the call today, who works on his intergenerational games, and there's all kinds of creative opportunities out there. I wonder if you're aware of or you could tell us a little bit how does intergenerational connection work in Southeast Asia?
Yeah, yeah. So I think this kind of like you said, the ideology of respecting and loving elderly people is a really, I think, big opportunity, and I think like help age in also have a very successful model on the co-intergeneration club. So they also work with the older association, but not only involve only elderly people, but in this club they also involve like other member in the society, in the community. So like younger people, so they form a club they call intergeneration club. So where the older people can share their wisdom, and then the young people will share some more like a skill that they can help the each other in solving the family issue or the community issue, and that model is very successful and very much recognized like in Vietnam, and it's start from the pilot program and now it become like a nationwide. So I think there's a good opportunity to do that. And then I think currently UNFPA is also implementing that they call the how like young people preparing for aging.
Hmm.
Uh,
Yeah.
so they work more they work more with young people than elderly people because I like young people thinking about that.
Yeah.
But in all those events, like the training, workshop, roundtable discussion, they involve older people in to discuss and share their experience, their challenge. So young people have like a better like a vision of what it means when you're getting aging, and what you should prepare to have like a better well-being when you aging. But then also they also understand more about their responsibility to support other older people in their
Hmm.
family or in their society. So I think it's really a nice approach to on that. um, but then I think somehow I think one hand that I found it's a very big opportunity, but in another hand I think that somehow it's still how somehow like reinforce the idea of taking care of elder people is a family issue. Like in the
Okay.
law, it says that children should take care of their parents, something like that. And so I think that and I found that if you want to provide like an universal care for older people, especially this like a long-term care. I think the role of the government is still very important, and
Uh,
and government should be accountable for that, rather than that teach these young people that you should taking care of yourself, taking care of
yes.
your parent, because it's in the law, and all this also reinforce this idea. And then sometimes people forget that, okay, but this should be what is the role of the government in terms of providing pension, so like a nursery home, immunization program for older people, yeah, all kind of thing. And yeah, so I think sometimes we should be alert, like aware about that.
Aware. No, that's really, really important. I was going to actually ask you about you mentioned immunization of older adults and immunization uptake. Um, how would you, can you just comment briefly on that? And then I want to ask you what your three top policy priorities you think that we should be thinking about or supporting in Southeast Asia with regards to aging. But before that, maybe just if you could just say a comment on what is the culture and adult immunization uptake and like in Southeast Asia.
Mm. I think adult immunization is something very new in the region. I think people was talking about that uh, after COVID. You start talking about in COVID. You start from COVID, and then people,
Uh-huh.
and then doing that after COVID. I think before that, no one really talking about adult immunization. Only the immunizations in the region still very much focused on the children.
Hmm.
And in many countries in this region, we provide like a free immunization program for the children. Of course, people can also use the pay for service if they want to have like a more like expensive vaccine or like an imported vaccine, something like that. But normally this program is provided by the government and free of charge. And then only I think in COVID, then people really emphasize how it's important for older people to get vaccine. And but still, it's not easy. I just see for example, this is the situation in Vietnam. Older people get into COVID vaccine much later than other group. If
Mm.
you look at like Europe, they they are come like the first, only after I think the healthcare, like the frontline healthcare worker, and then you get older people as like a priority group in getting vaccine, right? Like especially at the beginning of the pandemic, when vaccine still not very much available. But in Vietnam, the first thing is that of course the frontline worker, but then you have like young people, the working group because they want to protect the labor force. And only much later, after many like a statistic and also lesson come from other countries, then older people to get into the program. And then after COVID now, the COVID vaccine still provide by the government for older people, but that is the only vaccine
Okay.
provide. Yeah,
Well,
but for other vaccine, like influenza, like a seasonal influenza, pneumococcal, like it's people have to pay for that, and it's quite expensive, and
expensive.
only people in the and also often only available in big city, not in the rural area and in the commune. So I mean like
Uh-huh.
it's not accessible. So I think only like Singapore have a high uptake,
Uptake.
but for many other countries the rate is like 10% or almost none. Yeah,
Wow. Okay.
very very low.
We do have some questions in the chat, but do you have your three main policy areas that you think are going to have the biggest impact that we need to attend to in Southeast Asia? What do you think?
I think the first thing is I think one is that also on the I think communication. I think it's very important to increase awareness of the public and also of the health worker on the right and the needs of elderly people. This is a comprehensive needs of healthcare, including physical, sexual, and mental health care. That's not only some certain disease, but this really comprehensive needs and housing, social security, infrastructure. So this is something that the needs and the right of older people. I think this should be very important, and people, the public and the health workers should be aware about that. And I think secondly that it should integrate the healthcare for elderly people in a different scheme to make sure that it's available and affordable to people. So including from integrate that in the primary healthcare, on also have like improve that in the specialized care in the system, but and then also have like a community-based scheme. Yeah, because in the many of the country, the country in the region, going to the specialized doctor in the hospital is also difficult. So I think we should have like a different kind of a scheme that's available, and we have to train more health worker on provide care for elderly people. Um, and I think the third is that to ensure like I think financial security. I think mechanism for pension, for health insurance to make sure that people can every people can be like a safe and secure, yeah, and get older. And then I think to make sure that the policy also to pay attention to gender, yeah, and other diversity, like make sure that even like if you have the policy for elderly people, I think make sure that it should be gender sensitive and inclusive, because older people also very much diverse. and some have some other needs than others. I think it's important. And the last is that to make sure that older people can participate in the policy and program that serve them. So, and when you said elderly people, also mean that it should include the voice, not only older men, but also women and also other more minority older people. Yeah.
That's a great list. That is fantastic. Communication, healthcare, financial security, gender and diversity, and voice of older people, participation in the process. Excellent. I've got my notes. I've got my next article ready to go. I just some questions here that have been popped up in the chat. Robert, maybe Robert, would you like to ask Tu-Anh your question?
Yes, thank you so much, Gregor, and very nice to meet from the Netherlands.
Right,
So,
right.
yes, I'm just wondering about sports participation and active, healthy lifestyles, which is being promoted by the WHO and many other organizations. So, I was just wondering, could you say a little bit about this? How are sports popular? Do people at a certain age maybe quit sports? And is there some kind of promoting health, active aging, and active lifestyles? Thank you.
Okay. Yeah. Thank you, Robert, for this very interesting question. So I think like in this reason, actually, this reason that people not very active. I think compared to like especially if you come from Netherlands, right? Everyone bike. So I think in this reason more like even from children, I think more people more like stay inside and with a lot of requirement for study. So people not very much active, like physically active, since they're small, and it keep until like people get older. But I think recently there's a more and more movement on encourage people to work to be more active. Like there's a lot of running team or like a running program on like aerobic, like a thing like that. And also in city, people also build more public space for people to exercise. So if you come to and elderly people actually among the I think the one who are like a pioneer or very active in that. So if you go to you visit city like Hanoi, for example, if you visit like some of the lake or park, you will see in early morning, like 5 a.m., you will see most of the people there are older people who do all kind of exercise. And but this more I see in the city. But if you are in the like a more rural area, people do more exercise, but not like a sport. They do more like a core, core, not like a sport. Yeah.
Thank you. Is that okay, Robert? Thank
Did
you.
that answer your question?
Uh, Janine has been very active with all kinds of great commentary and ideas in our chat here. So I've asked her if she wants to focus in on one sharp question, and then we have one more question after that from Stanley and Shmuel, which I'll put together. But go ahead, Janine.
Oh my gosh, you have no idea the trouble you're getting yourself into by
Well,
giving me the mic. Um, Probably as a little prefix, at the beginning of last year, I did help the Southeast Asia WHO office in their report on how they're progressing in the UN Decade of Healthy Aging. So I love the region, and I think if we don't get aging right there, then the rest of the world is in trouble. We've just got such a huge population there. So I think the one thing that you didn't touch on, which I'll probably ask the question around, is around the changes that we're starting to see in causes of disability and death that we're seeing within the region, really moving away from those communal diseases now into non-communal diseases, and what sort of insights you have around there, and how can we kind of shift that back in the next couple of years to really help with bringing down those levels of disability, and making sure that older people are living their lives to their greatest extent that they can through into well into old age.
yeah. So I think with all kind of this, the modern life, with the change in the activity, food, and things like that, and also pressure. People live in, so non-communicable disease much more. increase in the also in this region. And the thing, I think one thing is that the service is often not available. So that is one thing that makes so many people not even most of these disease. Then you see that you can be like a preventable, and also if you have a good healthcare system, people can live healthily for a long time. But normally, I think the problem is that in those countries, the reason in in most of the place, the service not available at the like a grassroots level. So people not do the checkup frequently. People not cannot afford to have the medicine regularly or good counseling. So sometimes especially people have diabetes, for example, they take medicine, and then and they see the level of their glucose a bit stable, then they drop it. I have many of my friends working in the hospital, and they always are very upset that when the patient just turn back to them after they already they just stop the medicine. And the compliance rate in those countries also very low. So that is another thing. People just go to the pharmacy store to buy the medicine, and then they are the one who decide if they continue it or not. So that also the yeah the part of the problem. And I think we don't have many research on the compliance behavior, but I think it's important that to I think so these issues to combine both of the system, but also with the culture thing in the region. Yeah, so I think if it's and if the health insurance is not cover the treatment, then also it's difficult for people to afford it. Yeah.
Thank you, Tu-Anh. Janine, did that capture for you? That was great. Thank you.
Yes, I think that was exactly it. That not only do we have an issue with a population changing their diets and their habits, but then we don't have the system in place to really help along the
Yeah.
way. So yeah.
Yeah. And normally I think when doctor work with these people, they only focus on the very much technical issue, this is your blood pressure, this is your glucose and level, and this medicine. But no one really asks about if you can afford that, who will help you to remember to take the medicine, and yeah, and if you're running out of the medicine, what you can do. So I did a research, and the doctor only spend a 3 to 5 minutes per doctor, per patient in the hospital. Yeah, so they don't really have a time to provide counseling. And if you get in, and if you talk to an older people, like my dad who get problem with hearing, you know, then it's be very difficult for people really have a very good compliance and care after the checkup. Yeah.
Mm. Excellent. Just a question here. I'm going to combine together. Thank you, Janine. A question from Stanley and Shmuel. The lackage of professionals is always a question in many countries. Do you have any insights to break through this situation to help the community? For example, new technology. And Shmuel asks, how can AI technologies can support healthy aging? Can you comment on that?
Oh, I think that's a very good questions. And I think we're living in the technologies. And now you see in Vietnam, especially in the big city, many older people that get on Facebook, and that is so AI, and also but also social media. Because I think isolation is loneliness is one of the very big issue among elderly people. So many people that's got on Facebook and using internet. My mom, she's gotten that, and also now many people also look at AI a ChatGPT and start talking with the AI, because when no one that's talking with them. But then there's also another issue why I think it may provide some, I think, solution, but then also they also found like the older people is a target of all of the scam on the internet.
Right.
Yeah, yeah. So they sold all the thing to this older people through like connecting with them on social media and yes and like they use the technique like deep fake, the thing like that. So treat the older people and why older people they have a very limited literacy on AI or this thing, and they become the user. And but I think this is also a great area where this like agency working with older people, including like association of older people, should provide more like a training or information to help increase the literacy for people so they can really make use of these technologies in like a more effectiveness and also safer.
Digital
Yeah.
literacy and helping people navigate safely
Yeah.
technology and internet and
Yeah.
so on. Yeah.
Yeah, because also like in this reason, parent can sacrifice everything for their children. And every day I read on the newspaper like this mother or father receive a call from their daughter or son living like a study abroad and say that I in need of money. And they see the voice and they hear the voice, they see the face, they all made by AI, but they didn't know that, so they made the transfer and they lost. Some of the people they lost all of their saving,
Uh,
and then they become poor. Yeah, so that would be like a two edge of the technology.
yeah. Wow.
Yeah.
That's scary. Gosh, that's a whole other. We've touched on so many things today. We could discuss so many avenues here. I wondered if you might pull your thoughts together for a moment to add and maybe leave us with your last thoughts. Our discussion was challenges and hope, healthy aging in Southeast Asia. I wonder if you might share your main takeaways from our discussion or what you'd like to say. And while you're thinking about that, I'm just going to share with you our speaker for next week. This will actually be our last Global Cafe for the summer. We'll be returning after our global conference in September. We hope we'll all see you all there and at our next Global Cafe following the conference. So next week, I'm really excited to welcome our friend Dr. Rain Strobel from South Africa, from Cape Town. I am because we are aging and the wisdom of interreliability in South Africa. So that will be an exciting philosophical conversation with Dr. Strobel, who is with the ILC, among other things. And we're very much looking forward to that conversation. So hope you can join us. So back to you, Tu-Anh, if you have any closing thoughts to wrap up.
Yeah, I think I think it's just like I think the title of our talk today. I think we living in I think this is really a great time that I'm so grateful that I live in this time of that we can really discuss about this and recognize the needs, the issue of every people, but also to find the solution, also to see the opportunity, how we can change it, how we can make sure that people, older people can have like a healthy aging. And we live in a very challenging time also and it because and also I just see question Robert like why older people very much respect in the reason, but ageism still very much exists because also we are living in a time that we transition from the very tradition to the more modern areas, a modern time. So we have a lot of like conflict in value and transition in value. So it poses a lot of challenge that we should tackle, but then I think the foundation of the good things in there, and we can build better thing from that. Yeah.
Thank you, Tu-Anh. It was just wonderful to have you with us. Tu-Anh will be at our conference in South Africa, actually on a plenary symposium on low and middle income countries, as well as other symposiums on human rights. And so we're very proud to have the Tu-Anh as a director of our board of directors with the IFA. Thank you for your time with us today, Tu-Anh, and sharing your wisdom and insight, and for your tremendous work serving all populations in Vietnam and Southeast Asia and around the world. So thank you so much.
Thank you. Thank you so much. Thank you, everyone. This is my great honor to have this talk and sharing with you, and also learning a lot from your reflection in the chat and your question. Yeah, thank you so much. And looking forward to see many of you in the conference in September.
Thank you, everyone.